Hello, everyone. Thank you all for joining us here today. My name is Miranda Kennedy, and I'm the director of the ABLE National Resource Center. And I'm happy to be welcoming you to our ABLE National Resource Center June webinar on ABLE, Myths versus Facts. It's a pleasure to have you joining us today. You know, we chose the topic for today's webinar because we've really found that there are a number of individuals with disabilities and their families who've maybe heard about ABLE accounts over time, but who may still be reluctant to move forward and open an ABLE account for fear of losing public benefits. And there are many myths surrounding this and other ABLE account topics. And really today, the purpose of today's webinar is to dispel these myths and address them. So let's go ahead and go to the next slide. And for those of you who may not be familiar with us, we're the ABLE National Resource Center. And the ABLE National Resource Center, we're the leading comprehensive source of objective, independent information about federal and state-related ABLE programs and activities, including guidance on tax-advantaged ABLE savings accounts. It's our mission to help educate, promote, and support the positive impact ABLE can make on the lives of millions of Americans with disabilities and their families. Our pioneering work in this area and subject matter expertise makes us the foremost authority on topics related to the Achieving a Better Life Experience ABLE Act, ABLE accounts, state ABLE programs, ABLE-related policy developments, and comprehensive integration of ABLE and financial capability strategies for people with disabilities into public service delivery systems. Our email address is ablenrc.org, and we hope that you will be checking that out. We'd also like to thank our many sponsors, including the work and the sponsorship from a grant from Prudential, who helps sponsor our work. Before we get started with our webinar, I'm going to hand things over to my colleague, Maggie Redden, to just cover some housekeeping issues before we talk about the agenda and move into the topic of today's webinar. So Maggie, go ahead and take it away.
Yep. Hi, everybody, and welcome to today's webinar. The first thing is listening to the webinar. The audio for today's meeting can be accessed using computer audio or by calling in by phone. If you select computer audio, please make sure your speakers are turned on or your headphones are plugged in. If you do not have sound capabilities on your computer or prefer to listen by phone, please dial 929-205-6099 and enter the meeting code 222-047-154. Captioning. Real-time captioning is being provided during this webinar. The captions can be found by clicking on the closed caption icon in your Zoom controls at the bottom of the screen. If you do not see the captions after clicking the button, please alert the host via the chat box. You may also view captions in your browser at streamtext.net/player?event=NDI. Submitting questions. Please use the Q&A box to submit any questions you have during the webinar, and we will direct them accordingly. If your question is not answered during the webinar or you are listening by phone and not logged in, you may email your questions to us at info@ablenrc.org. Technical assistance. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the NDI host, or you may email mredden@ndi-inc.org. Please note the webinar is being recorded and the materials will be placed on the ABLE National Resource Center website, along with all of our other ABLE webinars at ablenrc.org/webinars. And with that, I will turn it back over to Miranda.
Thank you so much, Maggie. Well, first of all, I'd like to introduce our two presenters for today. And I think it's important to give you a little bit of background about them and who they are and what they're bringing to our discussion today. They've certainly learned a great deal about ABLE over this period of time, but they bring a wealth of information with them. So let me start with Lori Schaller, who is a manager of financial empowerment at National Disability Institute. Lori manages and coordinates activities and builds partnerships with federal, state, and local community leaders in her role managing the National Disability Institute's Assistive Technology Loan Program in New Jersey and New York. In addition, she serves as a nationally known subject matter expert on the public workforce system, Social Security, disability benefits planning, and financial education and coaching. Lori also served as a credit and housing counselor, directed a micro lending program, and served as a navigator with the New York State of Health Marketplace and worked as a disability resource coordinator for the state of New York. Lori is a certified community work incentive counselor and a key member of the ABLE National Resource Center team, providing support on disability benefits, assistive technology loans, and ABLE accounts. Marlene Uliski was a 35-year employee of the Social Security Administration, SSA, where she worked with partners across the state of Florida to educate them on the disability programs administered by SSA. After leaving SSA, she worked with the Florida Office of Vocational Rehabilitation to establish the Partnership Plus program under the Ticket to Work program, and then was rehired by SSA to conduct training and to assist them with managing critical integrity workloads, including Office of Inspector General investigations due to concealment of work and medical and work continuing disability reviews. At the ABLE National Resource Center, she's an essential member of our team, providing support to the center, our partners, and SSA beneficiaries on complex SSA issues when they arise. I give you that background on them because I want you all to know we're in really good hands with this topic here. These two know it very, very well. Okay, let's go ahead and go to the next slide. So our agenda for today. I'm going to be going through some ABLE basics, talking about our roadmap to enrollment and our roadmap to independence. While I'm doing that piece, people who know ABLE like the back of their own hand are welcome to go grab a cup of coffee and join us back here shortly, very shortly, for myths versus facts. However, we think that basics and that roadmap, that's going to be really helpful for those of you who, we know some of you are very new to ABLE, or maybe you're even intermediate, or have a knowledge of it, but could use some reinforcement, and it never hurts to get that reinforcement and to cover some of that, again, before diving into those myths and facts. So that's going to be, we're going to cover that in probably 5 minutes or so, 5 or 6 minutes. And then we're diving into the meat of the discussion today and the presentation. I'll hand things over to Marlene, and she and Lori will be going back and forth covering our myths versus facts, and the topics being eligibility, enrollment, contributions, public benefits, other financial tools. And then we'll have some next steps. We're also going to have a lot of great resources for you at the end as well. So, really, like I said at the very beginning, the purpose of today's discussion is really, we do understand that some individuals with disabilities, their family members, those who support them and work in this space, may still be reluctant to move forward with opening an ABLE account, using that ABLE account, because there's some fears around that related to these myths. So the purpose of this webinar really is to help dispel those myths. So let's go ahead and review those basics. Maggie, if you can take me to the next slide. Great. So first of all, what is an ABLE account? An ABLE account is a Section 529A tax-free savings account. Can you go back to the, thank you. Owned by a person who has a qualifying disability with an onset before age 26, and where they either receive supplemental security income and or Social Security disability insurance benefits, or where you may not receive those SSI or SSDI benefits, but have a disability certification from a licensed physician that indicates a qualifying physical or mental disability or blindness. Contributions to the account can be made by any person with post-tax dollars. We'll be covering that in more depth later. And an ABLE account will largely not affect eligibility for SSI, Medicaid, and other public benefits. And this, of course, may be crucial to many individuals in the transition phase or awaiting services or others. So let's go to the next slide. I'm sharing this with everyone. This is our roadmap to ABLE. We actually have 2 roadmaps. We have the roadmap to enrollment and our roadmap to independence. And I'm bringing this to your attention in case this is one of the first webinars you're seeing. We have some helpful information here. Each of these roadmaps has 5 steps to it, with a detailed level of information at each of those steps and a short video as well. The steps in the roadmap to enrollment cover what is ABLE, who is eligible, how can funds be used, how do I manage my account, and how do I enroll? And that enrollment piece takes you to how to shop the state ABLE programs comparison tool. Finally, once you have enrolled, we have the roadmap to independence for those account owners to help set financial goals, build that circle of support to contribute to that account, help make smart financial decisions, monitor the ABLE account, and of course, celebrate the financial independence that can come with an ABLE account. And these resources are also available in Spanish. If you go to the next slide, you'll see the map of how to choose the ABLE program that's right for you. And we also have a listserv that you can join as well once you hop onto our website. So you may already be part of that listserv, and if so, that's great. If not, please do sign up. Let's go ahead and go to the next slide. Just to provide some context, and this may be information many of you are quite familiar with, but in terms of having a disability, it really does come hand in hand with poverty and a lower economic status typically, because having a disability can be very expensive and or bankrupting. So in the US, people with disabilities, more than a quarter of Americans do live in poverty who have a disability. And of course, disability is an equal opportunity. Offender can happen at any time to anyone. And half of all people with disabilities have an annual household income of $35,000 or less. People with disabilities are 3 times more likely to have extreme difficulty paying bills as peers without disabilities, and are almost twice as likely to overdraw on checking accounts as peers with disabilities, without disabilities. Are also more likely than peers without disabilities to report they couldn't come up with $2,000 in an emergency, are 2.5 times more likely to skip medical treatment because of cost, and 2 times as likely to be unbanked compared to peers without disabilities, and 2 times as likely to use predatory lenders or pawn shops as peers without disabilities. So let's go ahead and go to the next slide, which really, you know, that context and those data points, you know, those are real people with real challenges, and it really does spell out the need for ABLE accounts. We can see here clearly millions of individuals with disabilities and family members are living in poverty or in low to moderate income status. These individuals and their families, many of you on this call with us here, depend on a variety of public benefits for income, healthcare, food, and housing assistance. So for the first time in public policy, the ABLE Act, the Stephen Beck Jr. Act, Achieving a Better Life Experience Act, better known as the ABLE Act, was passed with historic bipartisan support in 2014, where it recognizes the extra and significant costs of living with a disability. Eligible individuals and family members can establish ABLE savings accounts that will largely not affect eligibility for federally funded means-tested benefits. The funds in these ABLE accounts do not replace benefits provided by private insurance, Medicaid, supplemental security income, a beneficiary's employment, SSA work supports, vocational rehabilitation, financial aid, employment, training, and other sources. So they do not replace those. But ABLE savings can be used to supplement funding from those sources, and that can be a really essential supplement to that funding. So why save in an ABLE account? There's a resource limit of $2,000 for most means-tested benefits, but with an ABLE account, you can maintain eligibility for SSI, Medicaid, and other public benefits. ABLE savings of up to $100,000 does not impact SSI eligibility or monthly payments, and ABLE savings of any amount does not affect any type of Medicaid eligibility. And there are also ABLE account tax advantages. These accounts, the income in them can be invested through a variety of options offered by your chosen state ABLE program, and they grow tax-free. Contributions from family and friends do not count as income by federally funded means-tested benefits programs, and account owners, family, friends, and others can contribute up to $15,000 per year. And a working account owner can contribute more. We're going to talk about that more. So really, what ABLE does is it helps to promote health, independence, and a better quality of life for individuals with disabilities and their families. So that's some of the basics. And at this point, I'm going to hand things over to my colleague, Marlene Uliski, who's going to dive into the myths and versus facts and talk about eligibility and break it down for us. So Marlene, I'm going to hand the ball over to you.
Okay, thanks, Miranda. And I want to first thank you all for attending this afternoon. There's over 300 of you present today, and I appreciate the time that you're all taking out of your day to listen and learn more about ABLE and listen to the myths versus the facts. This is such an important topic for so many reasons. I think that some individuals and their family members, as Miranda had said a little earlier, are a little apprehensive about opening their account because they're relying on information that may not be true, it may not be accurate. So we wanted to set the record straight today and provide you with some facts so that you'll see the benefit of opening an account. And across the country, there's over 40,000 accounts opened. So that's over 40,000 individuals who have realized what positive impact an ABLE account can have on their lives. But we're not there yet. We have a lot more education to do because there's probably about 8 million individuals across the country who can actually qualify for these accounts. So let's get started. And the first thing we want to talk about on this slide rather, is the definition of a myth. And for those out there who aren't real sure of what we mean by a myth, we're talking about widely held but false beliefs. It's misinformation. It may be repeated in endless loops until it's accepted as a truth. When I worked at the Social Security Administration, I'd oftentimes hear the same information repeated by various applicants or beneficiaries or SSI recipients who shared information related to benefits. And many times it was incorrect, and it would lead them to other issues that they had not considered and which would impact their eligibility for benefits. Sometimes they relied upon information that they had gotten from their neighbors or their friends related to benefits, and it wasn't always accurate. So the most important thing is to rely upon information you know is accurate. If you'll go to our website at the ABLE National Resource Center, it's ablenrc.org, you'll find a lot of resources and you'll find solid references so that you know what is true and actually what is a myth. So I encourage you today, as we go on a little bit more, to listen closely at the facts so there's no misunderstandings about the ABLE law or the policy that's related to it. And as I said, all of the information, it is posted to our website, and in particular, all of the information related to policy on public benefits is posted to the website too. So on the next slide, we're going to jump right into the first myth or fact. I'm going to talk about 2 ABLE eligibility myths or facts, and the first one is this. And if you're so inclined, if you'd like to do so, I'd like you to type either fact or myth into the Q&A box. So the first one is, an individual must be receiving supplemental security income benefits or Social Security disability insurance benefits, and that includes disabled adult child benefits, to be eligible to open an ABLE account. Do you think that's a myth or that's a fact? If you would just type it in for a moment into the Q&A box. We're seeing a lot of myths. Seeing an awful lot of myths there. And then I'm seeing a couple of facts. And the answer to that is, it is a fact. So the statement is a myth. The individual may or may not be receiving benefits to be eligible to open an ABLE account. The individual who's receiving supplemental security income or Social Security disability insurance benefits, whose disability began before the age of 26, is eligible. However, other individuals are eligible as well, even if they're not receiving a benefit, if they meet the age criteria. On the slide, it states, even if an individual is not receiving SSI or SSDI, they may be eligible to open an ABLE account if their disability began before the age of 26 and they have a disability certificate signed by a licensed physician, an MD or a doctor of osteopathy, confirming that they meet a certain degree of severity with respect to their disability. Now, just to clarify things just a little bit, because a bit ago I just saw a question in the Q&A box related to medical certs. With medical certificates, you would just keep that on file. You would file it at your home. You wouldn't provide it to anyone unless you're asked to do so, unless you're requested. But you need that certificate prior to opening up your ABLE account, just so that you know. And that's only if you're not receiving benefits, disability-based benefits from the Social Security Administration. At the ABLE National Resource Center, sometimes we'll see that an individual does have a significant disability and it did begin before the age of 26, but the individual or sometimes the parent will wait until that individual is receiving benefits or until they're approved benefits because they think that's a requirement to open that account, and it's not. So just remember it this way: not receiving benefits, you need a medical certificate plus meet that age requirement. And if you are receiving benefits, you need to meet that age requirement. And next slide. Okay, on the next one, for this one, I won't ask you to type in the chat box because I should have asked this one first and the other question second, but we'll have more interaction in a little bit when Laurie and I ask you more questions. And with this one, an individual must be under the age of 26 to be eligible to open an ABLE account. And the answer to that one is, the fact of the matter is this, that an individual does not have to be under the age of 26 to open the account, but their disability must have begun before their 26th birthday. And what that means is this: an individual can actually be 30 years old or 40 years old or even older, but as long as their disability began before they turned age 26, and as long as it is a significant disability and meets that second prong that we talked about in the last slide, they're eligible to open up that ABLE account. So that means this: disability began before the age of 26, and they're either receiving Social Security benefits based on disability, or they have that medical certification. So with that, I think I'm going to turn it over to you, Laurie, to talk about some of the enrollment issues we've seen. Laurie?
Great. Thank you so much, Marlene. So now we'll cover the enrollment myths or facts. Next slide. Myth or fact: you have to open an ABLE account in your state of residence. And next slide. So the fact is that people can use our search tool to compare different state ABLE plans and make that decision which state ABLE plan best works for them. So we see that many people are using that search feature, and it is important that if your state offers a state resident tax deduction or credit, that you consider that that is a strong support that can help that contributor to that ABLE account be able to contribute more because they're getting a tax break with that option. But aside from that, people are looking at different state fees associated with maybe getting the money out of the account. You know, is it easy to get money in or out of that account? Is like a debit card offered or a checking service offered with that particular state ABLE program? And many people are curious, is that checking or debit card account within that ABLE account FDIC insured? So we welcome you to take a look and compare the state plan that you think best meets your needs. And each state plan at our website, we also show the state disclosure documents, so you can do further research from the basic criteria that we share with everyone. Okay, next slide. Myth or fact: an individual may only open an ABLE account through a bank. So Each state ABLE plan at this point only allows enrollment through the website for that particular state ABLE program. And programs are developed and managed at the state level, allowing that state flexibility to determine the process in which a person enrolls. To date, in an effort to keep costs low for these ABLE accounts and ensure affordable programs, enrollment and maintenance of the account is done through the individual state ABLE program site. These states also offer the option to enroll via mail or fax in some instances. But to learn if that's possible, you could go to the ABLE National Resource Center, click on the state ABLE plan that you choose, and that will direct you directly to the program site to open an account online. So let's say you don't want to open that account online. You would really like it if somebody would help you to open that account or to mail you a paper application. There's usually a contact us number at that state ABLE plan, often in the bottom right-hand corner. You can give them a call and see what other options they offer for opening an account. And then I'll turn the next question on over to Marlene.
Okay, thanks, Laurie. So going on, this next section, we have a couple of slides. We're going to talk about contributions and some of the myths versus the facts involving contributions. So on the next slide, and I'm going to ask you to type myth or fact into the Q&A box. Only the individual with a disability can contribute to an ABLE account. Is that a myth or is that a fact? Okay, and I'll just hold on for just a moment.
And Marlene, this is Miranda, just to clarify too. So when we come back down and say whether it's a myth or a fact later in the slide, okay, we're going to be saying when we say fact, that doesn't necessarily mean that the statement above it is a fact, right? It could be that it's a myth, but here is the fact of the matter, whether that's true or not, right? I just want to clarify that because I think that may have been a little confusing earlier.
Yes, that is correct. There's a statement above, and then we provide the facts related to that below. Yes, that's correct.
And it may be that it was actually a myth. So just to be very clear on that.
Yes, correct. Now I'm seeing on this one, and thanks, Miranda, for clarifying that. Gosh, on this one, I don't think this one tripped up very many people. Most of us do know the response to this one, and they know that that is a myth. Here's the fact. Anyone can contribute to an ABLE account, and that means anyone means family or friends or the individual with a disability or an employer or even a special needs trust. And just to clarify, a special needs trust, it's a person by IRS definition, and it's in the eyes of the IRS. And it's the same as a partnership or even a corporation. Those are also considered persons by the IRS. And importantly, even more important, is that third-party contributions to an ABLE account do not count as income. They never count as income, third-party contributions, so that's contributions by others. And then on this slide, I just wanted to clarify too that in addition, 529 college savings account can be rolled over into an ABLE account. And that's real important because perhaps we have an individual with a disability and their parent or maybe a grandparent established a 529 college savings account for this individual when they were an infant. But when the child grew up, they decided not to attend college, or college for some reason was not in their future. So that money's there sitting in the 529 college savings account. And that money actually can be rolled over into the 529A. That's the IRS designation for an ABLE account. It's called a 529A account. So it could be rolled over into the 529A. And we'll talk more about that as we go on. So that's really, really an important point. And also, too, if there is money in a 529A or in a 529 account, a college savings account of a sibling, and it's unused, that can be rolled over into a sibling 529A account. So those are really important points. On the next slide, and third-party contributions do not count as income. I guess I have a tendency sometimes not to read the slides, and I probably should get into a better habit of reading the slides a little bit better. Now on these myths versus facts, the next three items, the next three slides actually concern how much money can be deposited into an ABLE account. And the statement is that an unlimited amount of money can be deposited into an ABLE account. Now, is that a myth or a fact? Is the statement a myth or a fact? An unlimited amount of money can be deposited into an ABLE account. And if you'd like to type it into the Q&A box, that's fine. And I'm seeing a lot of, some facts, some myths, and then I see a qualification that $100,000 can be deposited into the account. And the answer to that is, that statement is actually a myth. It's not an unlimited amount of money which can be deposited into the ABLE account. So if we go on to the response, it says the total annual contribution by all contributors, including those identified on the previous slide, like family, friends, special needs trust, and others, is currently $15,000 per calendar year. Now that amount may be adjusted periodically for inflation. It's $15,000 by all contributors this year. Last year it was also $15,000, but the year prior to that it was $14,000, and it's tied actually to the annual gift tax contribution limit. And I saw a little earlier someone in the Q&A box asked, why is it $15,000? And I picked up that question and I answered it because it is by law tied to the gift tax. An individual with a disability, though, who is employed may be able to contribute even more from their earnings. And you may ask, well, how much more can they contribute to their earnings? $15,000 is an awful lot, but in the continental United States, and that's in the 48 states excluding Alaska and Hawaii, because their amounts are a little higher because they have higher cost of living, the amount that an individual who is employed can contribute is $12,140, or their gross earnings, whichever is less, in addition to that $15,000. Now that's those two numbers, $15,000 and that $12,140, that brings someone up to $27,140. That's an awful lot of money, which can be saved tax-free in that ABLE account. That $12,140 figure I just talked about, that can change because that's based on the federal poverty level for a household of one for the year prior to when the contribution was made. That's it's based upon last year's figure, but all you have to know is $12,140 if you live in the 48 states. If you live in Alaska or Hawaii, it's higher. And if you need those numbers, I don't know them offhand, but if you write to us at our info box, and that's at the end of this presentation, I'll be more than happy, or one of us on our team will be more than happy to provide you with that figure. Okay, so on the next slide, on the second slide, and it's continuing on with unlimited money can be deposited into an ABLE account. And the fact is that the total combined account limit is subject to the individual state regulations and their specific limit for education-related 529 savings accounts. Each state, the limit is different, and they range. There's a big range, in fact. In some states, it's as low as $100,000, while in other states, it's $529,000. In my state of residence, it's kind of towards the top end of that range. So when you're establishing an ABLE account, if that's important to you, if you will be using this account as, say, a savings or an investment account versus a transactional account, and by transactional I mean using it to pay for some of your qualified disability expenses or some of the day-to-day expenses, which are qualified disability expenses, you may want to look at that. You may want to look at the state in which you're establishing the account. And Laurie told you a little bit earlier that you did not have to establish your account in the state in which you reside, but you can establish your account in any state across the country if you meet a residency requirement, if they have one, and all states don't have one. In fact, most don't. Okay, so on the next slide, the third one, and again, finally, we're looking at the statement again. An unlimited amount of money can be deposited into an ABLE account. And there is a caveat for persons who receive supplemental security income benefits. Although their account can reach the state limit that we talked about on the last slide, only the first $100,000 is not counted by the SSI program. So the first $100,000 is disregarded by the SSI program. Funds above $100,000, they're counted along with other resources of that individual. And when the total exceeds the resource limit for that individual or for that couple, the SSI payment is suspended, but Medicaid continues. It's not suspended. That's a big, big distinction. So even though an SSI payment may be temporarily suspended, their Medicaid continues. Very, very important. Remember, there's a big distinction between suspension and termination. Because when the amount of $100,000, along with other resources like non-ABLE savings accounts or a checking account, when it then falls underneath the resource limit, the SSI program will then reinstate the monthly payment. And I don't believe that there's any accounts across the nation that are close to that amount, because the states only began rolling out their program after the law was passed. And it was probably, I think it was around 2016 when the first states rolled out their programs. So with a $15,000 limit per year, plus a little more for working individuals, the accounts haven't been nearing those amounts just yet. Just yesterday, I did a webinar in my particular state, and someone asked me what the procedure is regarding reinstatement of SSI benefits and whether they needed to report that to Social Security, to the SSI program, or whether SSI would know it automatically because they kind of know everything. And I didn't have a good answer for that because it's too early to tell right now. But that is something, it's a great question for us at the ABLE National Resource Center to send to Social Security for their consideration and clarification in their policy. We have a very good working relationship with them, and I think that that's something they're probably already looking at, but we thought we would just bring it to their attention, particularly because some individuals and family members are starting to ask that question. Okay. And with that, I think that one is my last slide. Oh, I have one more slide. Okay. And finally, if you'd like, type myth or fact again in the chat box if you're inclined to do so. Earnings or other income contributed by a beneficiary are not counted by means-tested benefit programs. Again, earnings or other income contributed by a beneficiary not counted by means-tested benefit programs. That means SSI, Medicaid, food stamps, and so on. Just type in myth or fact, and I'm looking, and I'm seeing a lot of myths, and I'm seeing a lot of facts. And that one, the answer to that is it actually is a myth. And as you'll see on your screen, the fact of the matter, it actually is the #1 myth which comes into the ABLE National Resource Center. We receive so many questions involving earnings, and many folks think that if they contribute their earnings into their ABLE account, it's disregarded totally. And that's not true, whether it's earnings or whether it's other income like pensions or retirement benefits or veterans benefits or alimony or workers' comp. Income deposited by a beneficiary, it's still kind of the same, whether it's deposited into an ABLE account or whether it's not deposited into an ABLE account. There are no changes in the way means-tested benefit programs count earned or unearned income deposited into the ABLE account by the beneficiary. It's not a way that a beneficiary can include income. It is a way to increase assets or increase resources. And another question which does come into the ABLE National Resource Center is some folks believe that by them not receiving that money, by it being directly deposited into the ABLE account, it's not counted. And that is false also. So those are, I think #7 is probably the biggest myth that we see, that earnings and other income contributed by a beneficiary into their ABLE account is not counted. So I think that is it. So with that, I think we've covered a lot of ground. But we want to touch on some other vitally important areas for many individuals, and that involves public benefits. So with that one, I think, Laurie, I'm going to turn it back over to you. Laurie?
Great. Thank you very much, Marlene. Okay, next slide, myths versus facts. If my ABLE account exceeds $2,000, I will lose my eligibility for SSI benefits and Medicaid. So if you'd like to type in your response in the chat box, is that a myth or a fact? Okay, we're seeing both myth and fact. If we could go to the next slide. So the fact is, the ABLE Act specifically states that funds in an ABLE account will not affect eligibility for federally funded means-tested benefits such as SSI and Medicaid. When the ABLE account balance exceeds $100,000, is combined with other resources that a person owns and it exceeds that person's SSI resource limit, then SSI payments are suspended at that time until the balance goes back below that $100,000 threshold plus countable resources for an individual of $2,000. For a couple who both receive SSI, the resource limit is $3,000. So that would be then that person's situation. But I wanted to make sure that everyone understands that any amount of savings within an ABLE account does not change eligibility for any type of Medicaid. And even if a person were to come out of pay for SSI because they have more than that $100,000 in their ABLE account and then additional savings elsewhere that's a countable resource, they simply come out of pay for that month. Once they bring that balance less than that $100,000 plus the $2,000 limit for themselves, then they would go back in pay status that next month for their SSI benefit. So that's a huge support, very powerful for ABLE account owners, that they are allowed to save, more than that $2,000 limit, up to $100,000 in that ABLE account does not count towards a countable resource for an individual. Okay, next slide. Myth or fact? If a beneficiary passes away, the Medicaid program always receives the balance in the ABLE account. So let's go to the next slide. So the fact is that when a beneficiary who owns an ABLE account passes away, all outstanding qualified disability expenses, including costs for funeral and burial expenses, are paid from that ABLE account first. Then, if that state has decided that they are implementing Medicaid payback provisions, then the Medicaid program for that resident of that state steps in and will claim whatever was paid for Medicaid expenses since the time that individual opened their ABLE account. So we know that many people do not have Medicaid. They have a disability. They are still eligible to open an account. They have no worries that Medicaid would step in and take those monies that remain in that account, if there are any monies left over after paying for funeral and burial expenses. When people open their ABLE account, they can either contact that state ABLE program and ask, can I name a beneficiary now for my account, or sometime in the future, how do I do that? Or does that particular individual need to set up a will stating that any remaining monies within their ABLE account would go to a friend or family member in the event of their death? So I just wanted to share with people too, there are many states now that have waived the Medicaid payback provision for their state residents who choose that state ABLE plan. So this applies to individuals who live in Arkansas, California, Florida, Kansas, Illinois, Maryland, Pennsylvania, Oregon, and West Virginia. And we know that several other states are looking at the possibility of eliminating the Medicaid payback provision. So that information is always posted at the ABLE National Resource Center, and we welcome you to, sign up for our Achievable newsletter, where also you will receive an email indicating any change related to ABLE accounts in your state. Okay, next slide. Myths, other financial tools. And next slide. Okay, myth or fact, ABLE accounts replace special needs trusts. So let's move to the next slide, please. So we've been working very closely with the Special Needs Alliance, and we know that many people will benefit from having both an ABLE savings account and or special needs trusts or pooled trusts. And like Marlene had shared, a special needs trust or pooled trust can make a deposit into a person's ABLE account each year, totaling up to $15,000. And these accounts work very well because a special needs trust or pooled trust is prohibited from spending those monies on housing expenses or food. So within the ABLE account, when those same monies are deposited into an ABLE account, we're meeting many people. They're saying that maybe their SSI or their SSDI was never enough to help them pay for all the costs associated with their housing. Once those funds are deposited within ABLE account, then that person who owns that ABLE account can use those funds to cover additional expenses for housing expenses. So maybe utilities or property taxes or mortgage insurance or homeowners or renters insurance, for example. And that is helping people in many instances to upgrade the quality of their living. They are able to choose another place to live that improves their quality of life. And that was really the intent of the ABLE program, to achieve a better life experience. And so we would like to also share, we recently worked with the Special Needs Alliance to prepare a tool that helps to compare how an ABLE account can help an individual in comparison to a special needs trust or a pool trust, and to see how those accounts can all work together to better meet many individuals' needs. So often a person will call and say, gee, I just came into an inheritance. It's more than $15,000. What can I do with that money? Can I open an ABLE account now, deposit $15,000 into that ABLE account? Yes, and then the additional monies, for example, can go into a special needs trust or into a pool trust. Or in some cases, people are spending that down because they needed to purchase something anyway, and then, you know, their needs are met to handle those additional dollars. So the link to this new tool that we have posted on our website will be shared within the resources section. Okay, and next slide. Myth or fact, ABLE accounts are the same as 529 accounts. And let's move to the next slide. So the fact is that the ABLE savings accounts are set up in many instances from the same authority that offers the college savings accounts in states. And in some cases, the rules are the same, but there are many differences. For example, a person can have several 529 college savings accounts, but an individual who has a qualified disability is allowed one ABLE account to meet their needs. 529 college savings accounts can only be used for qualified education-related expenses, while ABLE accounts can be used for qualified disability expenses that include things like education, training, supports maybe in the workplace, housing expenses, to purchase a vehicle, to purchase assistive technology, to purchase a home. Then anyone can open a 529 account for someone who wants to go to college, and that individual can control the funds. Only a beneficiary may open an ABLE account and control the funds, subject to legal guardianship and power of attorney rules for that particular individual. So let's say a grandparent can open a 529 college account for their grandchildren. Often those accounts are not set up in those grandchildren's names, but they can be earmarked by that grandparent, intended to be used by those grandchildren. But an ABLE account, when it is opened in that individual's name, and they can ask family members, and certainly their legal guardians and power of attorney can help them to manage the savings within their ABLE account. And this is really a great opportunity for having dialogue as early as is possible with our family members about them learning skills around managing their own monies and preparing like a budget. So like many people who have been calling, we're suggesting that they develop a little budget. Okay, so maybe this person receives SSI. So we know from their budget they need to use that SSI to pay for their housing expenses and for their food. If there's additional money left over after paying those expenses, they can deposit that within their ABLE account. But what other expenses does the person want to use the ABLE savings for? So maybe, you know, the person pays for a bunch of things. So maybe what we want to do is help that person to prepare that monthly budget and their income from SSI, SSDI, maybe earnings, will be used to cover regular monthly expenses, or maybe just one line item will be identified from that person's budget so that they can pay for the utility bill. And then they'd simply keep that receipt for that calendar year, and it makes it easier should they ever be audited by the IRS. They can demonstrate that the expenses were qualified disability expenses, and they have receipts from their utility bills showing that they use their ABLE account to pay for that expense. So I think preparing that household budget can help to eliminate the need for many, many receipts, and to know for sure that those are qualified disability expenses. And then too, I'd like to touch on one more thing. So we covered the fact that people can have up to $15,000 contributed to their ABLE account in a calendar year. If that person works, they are allowed to contribute additional monies if they do not have an employer-sponsored retirement account, and those additional contributions would come from their earnings. So if a person has maximized all those earnings and they've spent their ABLE account savings on all of their monthly expenses, because they've already reached their maximum contribution level for that calendar year, they cannot accept other contributions that might come later in the calendar year. And you might want to leave a little bit of space should, you know, a great aunt somehow pass away and want to leave you additional monies, that you can make that contribution into your ABLE account as well. And then I'm hoping that all of our participants today have a better understanding of myths versus facts around the ABLE accounts. And I would like to hand this off next to Miranda.
Great. Thank you so much, Lori and Marlene, for walking us through myths versus facts. But wait a minute. I think all of those were myths, right? And then we followed up with the facts. And if I'm looking at this accurately, all the folks who responded in the chat, I have to say we have a very savvy group here of folks who contributed answers. There might be others who are listening who didn't pipe up in the chat, but a lot of the folks who got on the chat, they really nailed it. All 11 of those statements, as you could see in the follow-up, were myths, right, Lori?
Yes, that's correct, Miranda. Thank you.
All right, okay. But still, thank you everyone for playing along with us. And also, we hope we helped to spell this out further and in a helpful way. We do want to make sure that good, accurate information is out there, and that you're taking a look at the fact side of those slides, and able to use that information moving forward, and feeling some more confidence about what ABLE is and what it is not, and the opportunity that it would present to you or your family in terms of being able to, you know, achieve the better life experience that is the potential of the ABLE program and those ABLE accounts. So as part of that, let's go to the next steps and talk about financial independence in ABLE. And really some of the next steps are moving forward with, you know, opening an ABLE account early and learning the rules of the program, and really knowing and learning about all the public benefits that you receive and how ABLE can fit into that. Or if you don't receive benefits, you can still benefit from ABLE. Of course, also making contributions and encouraging contributions from family and friends and others. We've got a lot of great resources in our webinar, including how to make wise decisions about qualified disability expenses and maintaining good records and receipts. Marlene and Lori touched on a number of these things. Everyone's situation, all of your needs and your goals are unique. We have a lot of great resources, other webinars, other case summaries, other materials and supports available for you at ablenrc.org to help you do some more research and make the most of your ABLE accounts. So as part of that, the next slide talks about, you know, if you are working or planning to work, you know, and we talked about this with benefits, make sure you're working with your SSA, you know, your work incentives, so that you can maximize potential savings. You want to be working with a benefits counselor if you're working check out that Choose to Work website, choosework.ssa.gov, to find a benefits counselor if that's going to be supportive of you in your scenario. On the next slide, we include a number of resources on ABLE accounts. You know, what are they? How to become ABLE ready. We actually have that ABLE special needs and pooled trust comparison chart that was referred to earlier. We did that in partnership with our Special Needs Alliance partners, who are special needs trust attorneys. So that's a very comprehensive resource. If that would apply to you, check out that resource. On the next slide, you'll see some other federal guidance for federal programs and how they intersect with ABLE. So we've provided the links here for folks who are receiving supplemental security income, for Centers for Medicare and Medicaid Services if you're receiving Medicare and Medicaid, for the SNAP program and those benefits, and housing and urban development. We do have resources, there's guidance from HUD on ABLE accounts that's fairly new out as of April 26th. I know that was a question in the chat. So check out our resources here for more guidance on that. And finally, help us spread the word. Please share information about ABLE accounts with your friends, your family, and your community. And if you're not signed up, sign up for our Achievable Monthly newsletter and connect with us on social media, on Facebook and on Twitter, @the ABLE-NRC. And participate with us on future ABLE NRC Center webinars and stay informed about that. We actually, if we go to the next slide, we're not having a webinar next month, but we are having our Able to Save video contest leading up to our hashtag Able to Save month in August, which is going to be very comprehensive. You'll want to join us for that, hopefully. But we'll be running an Able to Save video contest throughout July. So sign up for our ABLE NRC emails about the video contest. You could be part of that. And stay tuned and become part of our Able to Save campaign. And more details will be coming soon. All right, finally, on our Contact Us, we have here's how to contact us. You could contact us at info@ablenrc.org. You can call us at 202-683-6094 or visit our website at ablenrc.org. And we'd, of course, like to finally thank again our ABLE National Resource Center sponsors for their generous support of our work as we spread the message about ABLE. Thank you, everyone, for joining us here today. We look forward to seeing your videos come in and having you join us on future events with us and hearing your stories. Thank you, everyone. Have a good day.